Hey sisters! We're back to talk about genetics and breast cancer and to dispel 4 of the most frequently heard myths. One way to learn more about your personalized risk of breast cancer is to have genetic testing. Genetic testing is a way to look at your genes to see if you are at risk for any diseases. For example, triple-negative breast cancer is a more aggressive form of breast cancer that tends to occur in young women. While it is more common in Black women, it is often linked to changes in a specific gene called BRCA1. Myth number 1. No one in my family has the breast cancer gene, so there is no need for me to get genetic testing. Genetic testing is a great way to better understand your risk of developing breast cancer and should be considered for those who have a personal history of breast cancer or a strong family history. Genetic testing involves a blood or saliva test that helps identify mutations or changes in your genes that increase the risk for developing cancer, including the BRCA genes. Myth number 2. I eat healthy and exercise, so I don't have to worry about developing breast cancer. Although these lifestyle behaviors help lower your risk, they can't completely eliminate it. It's important to be aware that there are things we can and can't change to reduce our risk. For example, for some women, it is recommended to get mammography and MRI for breast cancer screening. Genetic testing can help determine if you are someone who needs to start screening early on or needs more frequent screenings to find breast cancer. Myth number 3. My genetic test results will be shared without my consent. Genetic testing is a way for both you and your family to better understand your risk for developing breast cancer. The results are kept confidential and are shared only with you, your genetic counselor, and your doctor. Just like your health information, the blood or saliva that was used to generate your results cannot be shared. Myth number 4. Genetic testing is never covered by health insurance. Genetic testing is actually covered by many insurance plans, but might not be covered in full by some of them. Be sure to talk with your doctor about any out-of-pocket costs that might occur. We hope this information helps you better understand breast cancer genetics and the importance of genetic testing. Be sure to talk with your doctor for more information about your options for assessing your personal risk for breast cancer.